Now we're recording. Great. Okay, so I'm going to give a real brief introduction of our panelists. Then we're going to watch the video. So this is the first time that we are showing it publicly. And then we will, I will allow the panelists to give a little more introduction to who they are and why this issue is important to them. And then you guys can we'll open the floor and folks can ask questions. You should see a Q&A box. You can put your questions in there at any time, even if we're in the middle of the video. If something comes to mind and you want to put a question in the box, go ahead and do it, and then we'll answer it when we have a chance once the video is over and the panelists have presented themselves. So just real quickly, we're here with the three women who are starring in the video that we're about to watch. So Stacy Jennings from Columbia, South Carolina, Shyronn Jones from Atlanta, and Tiommi Luckett in Philadelphia. We're also here with Bruce Richman, who is a founding partner of the U U campaign, the Prevention Access Campaign. We have Dr. Ben Young, who's in Colorado, and he is the Chief Medical Officer of the International Association of Providers of AIDS Care. And we've got Shannon and Becca Schwartz in San Francisco at UCSF's HIVE program, and they help serodifferent couples conceive and let them know about their options around breastfeeding, all of that. So we've got a great panel to answer your questions. And with that said, we'll go ahead and start the video, and I will let the panelists introduce themselves a little bit more once we have seen the video. So I'm gonna go ahead and start the video. When it starts, if anyone has trouble hearing, please put a note in the chat box, let me know, but it should work just fine.
U equals U means undetectable equals untransmittable. When a person who is living with HIV is undetectable for 6 months or longer and adherent to their regimen, they cannot transmit the virus to their sexual partners.
Virus suppression means health. It's an epitome of health. It's the picture of health. It's the picture of strength. So I have been undetectable for going on 15 years.
The first thoughts that went through my mind when I received my HIV diagnosis was my son, who was 4 at the time. I thought about him not having his mom in his life the way I didn't have my mom in my life. My mother passed away from kidney failure when I was 12, and I thought I will only have 10 years to live. And I thought by the time he would be 12, I wouldn't be in his life. And I felt as if I let him down by allowing myself to contract this virus. And I was very upset with myself.
All that he could tell me was that the test came back positive. And it was basically, I wish you well. I don't know what to tell you. I'm not an HIV specialist. This is not my field, right? So for the next 3 months, all I could do was just cry because I didn't know where to go. I researched HIV, Arkansas, AIDS, Arkansas, HIV, Little Rock, as much as I could, and I came up clueless, empty. So the whole process from diagnosis to taking my first treatment, my first cocktail was 3 months. It was 3 months for me. I was really serious. I wanted to live.
To start it back in 1995, it was the beginning of October. My son was about 13 months old. I was working at Little Caesars Pizza, and I ended up going into the hospital. And the doctors, they were trying to figure out what was going on. They said, well, we can't figure out what's going on. Your diabetes seems to be doing okay, and your blood work looks good. But you have, tattoos, or you have a nose piercing. Do you mind us taking an HIV test? And I said, well, no, go ahead and do what you have to do. And so they did the test, and so it was probably back then in 95, it took about 2 to 3 days. And so it was like 20 doctors. They walked in my room, and I immediately dropped my head and I said, oh no, you know, what could be wrong? And when they came in, they apologized. And I'm like, okay, what are you apologizing for? We're sorry, but your test came back positive for HIV. And that day, October the 17th, changed my life forever.
Once I went to the lab and took more tests, that's when things got really emotional, and I was no longer able to have a bold persona. I'm just watching her gather the things and, you know, put the tourniquet on, about to insert the needle, and I asked her, like, aren't you gonna put any gloves? And she was like, no. And she told me that I'm not gonna get her sick and she knows how to do her job. And I had an emotional rush of unconditional love and care that she was showing me at that moment, her knowing that this is something I have to deal with for the rest of my life. And she really, you know, extended herself to just show me that I'm not someone to be afraid of. And it really impacted my life even to this day.
I don't think most women have this information. I think this information should be available everywhere. I think it should be available in the magazines, in the doctor's offices, in the train stations, in the bus stations. Wherever it can post it up, it needs to be available on the billboards, on TV commercials, on computer screens.
I was never told by my doctors that if I was on medications, I would not be a risk of transmitting HIV. Now that I know that I cannot transmit HIV because I have a suppressed viral load and I'm undetectable, I do feel betrayed by my medical providers of not giving me that information.
And I would go to my doctors, and you know, the doctors a lot of the times, but they are very ignorant to the fact that, okay, I'm undetectable. So it's almost zero that I can transmit this virus. And they're still saying, well, you still need to use protection, or you still need to do this, you still need to do this. And a lot of the doctors still don't understand. And they're like, okay, so what does that mean? Even in the hospitals, when I go to different doctors, they're always like, what does that mean? What is your viral load, or what is your CD4 count?
When I first heard U equals U, it was confirmation for something that I knew internally. Right? It wasn't something that I heard before. In fact, the first time that I heard about U equals U was last year in 2016. No one can tell me that I'm a danger to anyone. You know, like I feel so much better. I really do. It means that they are not a weapon. You know, sex is not a weapon. Sex is healthy. Sex can be healthy, sex can be enjoyable, sex can be pleasurable, even after an HIV diagnosis, right? In fact, you know, have plenty of sex, you know, as much sex as you can. It keeps me youthful.
U equals U give persons living with HIV a chance to live and to be free and to be happy and to have a life again. The first time I heard U equals U, I became hopeful. And it gave me the strength to persevere and to keep on keeping on no matter what. No matter what this doctor says, no matter what they do to me, no matter what people say, U equals U. And that means everything in the world to me. being a woman living with HIV. It means for my sex life that I can have more sex, you know, I can have more sex without feeling guilty, you know, with my partner, with my mate. And, you know, I can feel free. It brings about freedom, you know, and inner peace from the inside out. You know, I can smile again, and I can be happy within myself. And at the same time, not having to worry about, am I going to transmit HIV to my mate?
I haven't let my diagnosis stand in the way of me achieving family and friends support, romantic relationships, a successful career, home ownership, and meaningful involvement in advocacy.
This status is not going to define you. You're going to run into stigma, fear, ignorance. You're going to feel shame. You may even want to isolate yourself. It's perfectly understandable. I did. A lot of us do. But just don't stay there. Don't stay there, and you don't have to go there alone. You will have people like me, people who are genuinely concerned about your health, your well-being, your mental health as well, who will be there with you every step of the way. We are definitely stronger together.
Undetectable equals untransmittable.
Okay, now I'm unmuted. Thank you guys so much for sharing your stories with everybody, for, you know, bringing U equals you the attention that you need. Can everyone hear me? I'm getting a weird message. Yeah, okay. My computer was telling me that it wasn't getting sound from my microphone. Okay. Great. So thank you everyone for watching. I hope everyone, you know, really enjoyed that. Before we go right into the Q&A, I want to let the panelists introduce themselves a little bit, just give a brief intro of who they are and why U equals you is important to them and why this is something that they're talking about. And let's go ahead and start with the women who were in the video in alphabetical order. Stacy, do you want to start? My last name.
Hello, everyone. My name is Stacy Jennings, and I get very emotional. But U equals you means so much to me because it gives me the freedom to live and to be who I need to be in spite of and because of. And I just want to thank Bruce, and I thank him each and every day because U equals you has allowed me to live. It has allowed me to be free. And it has allowed me to be strong in spite of my son being taken away from me. Because of my undetectable status, my son was born HIV negative. But he still didn't get the chance to live. So I live by U equals you every day of my life. Thank you.
Thanks so much, Stacy. Shyronn, would you like to introduce yourself?
Hello, I'm Shyronn. I'm a Brooklyn native. I relocated to Albany, New York to continue my education and my career in the field of social work and HIV advocacy. In Albany, I interned at the New York State Assembly. I worked as a retention specialist for an infectious disease clinic. a case manager technician for a nonprofit organization providing intensive case management, 2 people living with HIV, a case coordinator for a housing provider, to name a few, just to give you a sense that I have been surrounded by many doctors and medical case managers, and this is information that is new to me. I'm currently living in Atlanta. I'm the CEO of I Know Awareness, a vessel I use to educate about HIV with care, not fear. And I also provide direct and collaborative support of HIV initiatives. And I look forward to talking more about why U equals U is important to me.
Great, thank you so much. Tiommi?
Hi, everybody. I'm Tiommi Luckett. I'm currently living in Philadelphia. A lot of you remember that I'm from Arkansas. I am the communications assistant with Positive Women's Network. And yeah, so when I was diagnosed with HIV back in 2012 and actually got into treatment in 2013, by April, I was told that I was undetectable, and I asked what it was. And he said that there was a reduced risk of me transmitting the virus. So I asked by how much is that reduction, and the number that I was given was 96%. So there was still a 4% chance that I could transmit the virus. That put so much fear in me that I took myself off the market. I stopped dating, I isolated, I became a hermit. I didn't tell my family for a year and a half. I went through basically all of that alone. You know, I knew that the medicine was working. And like I said in the video, it didn't take, you know, someone telling me that I wasn't a danger to anyone else, right? It was something that I felt. It was more of a confirmation. When Bruce stopped me in Hollywood, Florida, just out of the blue, you know, and it started with a blog that I wrote, and I talked about how I just knew that I was healthy, and it touched him, and he reached out to me, and I was one of the first people that he pulled into the phone, you know. So for me, much like Stacy said, it gave me the freedom to actually unlock myself from the rest of the world. I'm not a danger to anybody. I'm not a danger to myself, and I'm not a danger to my loved ones. Even though we don't actually talk about it, I know that I have a community of people who understand everything that I've been through, everything that I will go through. So for that, I'm eternally grateful.
Thank you, Tiommi. Great, well, Bruce's name has been thrown out there a lot. So Bruce, would you like to introduce yourself? And you're on mute.
Oh, sorry about that. I'm Bruce Richman, and I learned in 2012 from my doctor that I couldn't transmit HIV, and that changed my life because I had been isolated and turned to all kinds of self-harm and doubt because of feeling like I could infect someone that I loved or want to have sex with. But not everybody was being told this, and I was outraged. And so the campaign kind of came from that social justice perspective and human rights perspective that everyone deserves this information, period. Everyone living with HIV anywhere needs to know this information about our bodies. And so our first push, as all the panelists know, because mostly everyone was a champion and warrior on this, was to get the science out of the dark. So push the science out into the dark, working with the researchers to confirm that it's true, get it out there. And now we're in a really good place where we're working with lots of partners around the world, 500 partners in 68 countries, to make sure everyone knows this information. And when I hear, stories, like we're hearing now from Stacy and Tiommi and Shyronn, it makes me really angry. So I yell at a lot of people. I kind of am known as a bully, I think. I just yelled at an organization yesterday and they probably don't like me anymore. But we all need to know, and there's no point, there is no excuse for gatekeeping this information. We all deserve to know we're capable of learning this and handling this information. And so I'll continue to fight until everyone living with HIV knows this information, because I know how much it changes lives. Thanks for having me on this call.
Thank you so much, Bruce. So let's keep going in alphabetical order. Shannon, would you and Becca like to introduce yourselves and HIVE a little bit?
I'm Becca Schwartz. I'm a social worker with the HIVE clinic in San Francisco. And I've been here about 14 years doing this work, and have had the privilege of being able to give this message of U equals U to pregnant women in the context of pregnancy care, that they can feel safe and confident and comfortable with their pregnancy, because undetectable means untransmittable, and they're going to have an HIV negative baby. And that's been such a joyful piece of my work. But seeing this video and the way that this is being expanded now, because it was too narrow in focusing on pregnancy, right? And stigma still impacts our patients so profoundly, and particularly in terms of their intimate relationships and sexual relationships. And so stigma has never been, it is the enemy of good health, is the enemy of good mental health, is the enemy of prevention, in my view. And so I'm just thrilled. I think this is beautiful, and thank you.
And I'm Shannon Weber. I'm the director of HIVE and work with Becca. And so much of my work is focused around HIV negative women with positive male partners wanting to have babies, and really being grounded, like Becca says, in this reproductive justice framework. Even before it was super clear for us that U does equal U, I still feel, like Bruce's anger piece around women just having the right to choose what they want to do with their bodies and who they want to have sex with and how they want to have a baby. That still feels like fundamentally underneath it all so important to me. And it's so valuable now that we have this really clear messaging that we can bring for women. So regardless of their HIV status, and regardless of whether or not they want to have a child, that they have equal choice around those options.
Great, thank you so much. And Dr. Ben.
Well, hello everybody. My name is Ben Young. I am proud to call myself a physician, scientist, human rights activist for the last 25 or 30 years. I've been an HIV specialist my entire career, and I'm currently the Senior Vice President and Chief Medical Officer of the International Association of Providers of AIDS Care, a very lengthy name. We call ourselves IAPAC. And IAPAC is very proud to be one of the 300 organizations that has partnered with Bruce and Prevention and Access Campaign around bringing the U equals U message to providers around the world. IAPAC represents, and I represent, about 30,000 frontline HIV care providers in over 100 countries. Bruce and our organization just signed a memorandum that will, let's say, accelerate the exchange of that information in 5 or 6 key cities starting next year and the world thereafter. So I'm probably the least important member of this panel. I'm really honored to serve on this group with a bunch of very, very courageous, mostly women, and Bruce. I'm again, pleased to be able to answer some questions from a medical scientific perspective. But again, the messages both in the video and what you've heard in the last few minutes are both courageous and absolutely inspiring. And I'm just, I feel privileged to be part of this group.
Thank you so much. And thank you all again for being here. So we'll go ahead and open up the floor to questions. Naima is already asking a question here in the box. So she says, I think this is great. Now how can I teach others? Even positive people have a hard time with U equals U. And she actually has 2 parts of the question, but I'll start with that one because it's a little bit different from the second part of her question. what kind of, I guess the question would be sort of what kind of challenges have you run into sharing the U equals U message? Like she mentions, even people living with HIV sometimes have a hard time accepting this message as true. I know that the women here who were in the video, Shyronn and Stacy and Tiommi and Bruce have run into this before. So can you guys share just a little bit, you know, what people have said and how you've countered that and sort of what that experience has been? And any of you feel free to jump in.
This is Stacy. I was having a conversation the other day with a prominent person who is in the community. She's a great big advocate, but she says, I hate U equals U. She said, how can HIV be undetectable? It's still in your body, so how can it be undetectable? Because if you take a test today, it's still going to show up. And I explained to her, I said, you know what? U equals U. I said, undetectable means that I cannot transmit this virus. I said, my partner is safe. I feel safe. And so we just kept going back and forth, back and forth, back and forth. And I said, you know what? People feel what they want to feel, but I believe in U equals U. And so I just shut the conversation down because she was just, you know, just bound to say, okay, well, you know, I don't believe in it. But I said, someday you will.
Yeah, that's, Stacy, I get that too. You know, that's when people say you're only as good as your last viral load test. And that's a scare tactic. That's fear mongering, and that's not helpful to say to people. And it's durable. What they call durable is if you take your medicine every day, if you're adherent, you're going to stay undetectable and untransmittable. It doesn't shoot up to infectious levels at any moment. And we combat that a lot. What we see in the United States is that, like exactly like you're saying, there are people in positions of authority within the POS community that hate this campaign, exactly like you said. And so then it doesn't trickle out to their own networks. People feel silenced. So that's one of the biggest problems that we come across in the United States. I think we need to do a training for US leaders, HIV positive leaders, with scientists so that they can sort of become more comfortable with it. They don't need to say U equals U, but if they could just get this information out to people with HIV in ways that make sense for them and accurately, that would be helpful. Because I know exactly what you're talking about. I've heard the same thing from several major HIV activists in the US.
No, there's one background piece of information that, in a sense, is part of the larger subject of HIV therapies and viral suppression and transmission risk. We are involved with a campaign with UNAIDS and the Global Network of Positive People on an international scientific consensus statement around sexual transmission of HIV. And in that statement is a review of all this literature. And the one really core important piece of this is actually to understand that there has never been a documented case of HIV transmission with somebody with a viral load less than 1,000. Never mind on treatment, never mind viral suppression at 200 and so on. So when we look at the larger construct of risk and transmission, having an undetectable viral load takes you so far down the risk spectrum, including these viral blips, including what the level of detection in a particular test is and such. So the U equals U to me is the culmination of the lowest possible level of viral suppression, but the risk of transmission is zero when viral loads are below 1,000. So that's the larger view. And a lot of people get hung up on even low level detectable virus and viral blips as good as your last viral load and such. And when we look at the entire spectrum of risk, again, that goes down with viral loads far higher than whatever the level of detection is.
I want to pop on and say something. I think one, that I am in awe of these powerful women who've come forward and shared their stories. And I think we need champions to come forward with the message. And as much as I am in awe, I want to say the burden is not on you to make other people believe. It is the responsibility of the funded programs and the providers to tell the truth. And, you know, awesome for you for talking with your neighbors and your friends and everything, but the burden should not be on you. The burden and the responsibility should be on the government and these medical provider organizations to change their practices and to tell the truth, to stop lying to people. And this is some of the other powerful work that Bruce has done, which is one, really helping with the messaging and getting scientists on board, but then also holding people accountable for what they say in their videos and what they say on their websites. And I want to say, in our program, we've changed our language several times. It's not easy, and we want to only get better at it. We have to get to the truest thing we know and then see how it resonates with different stakeholders and make sure that we're actually communicating what we hope to communicate. So it's a journey and there is work involved, but I do feel that we really need to honor people living with HIV for what they're doing, and at the same time hold people with privilege, with funding, with stature, with responsible for their words.
Great, thank you. Thank you all so much. So I'm going to throw another question out there. Vicky is asking, she says, sorry, I just got another weird message on my computer. Okay, she says it's important that this information be disseminated to all medical providers. Are there plans to educate dentists, surgeons, and other health professionals outside of the HIV community?
Well, maybe I can at least try to touch that. Thanks for your question, Vicki. From the perspective of medical specialty, IAPAC is certainly not restricted to physicians nor medical providers. And so our aim is very broad. And I would actually say that our aim also extends to policymakers, governmental officials, and so on. And that is certainly our objective in the collaborations. It's a difficult thing, a more difficult or more challenging thing to reach non-HIV providers. And that end leads medicine, general family medicines and medicine stations. And perhaps it gets back to some of the earlier comments that Shannon spoke to. I think that first and foremost, it's important to recognize that a lot of these providers are people living with HIV themselves, and while it's important to be advocates for the communication, I think there's also a need to develop a non-stigmatizing approach to educate providers about how to do this correctly, rather than isolating and criminalizing those providers who are actually providing HIV care to the community. So I think it's a balancing act. There's certainly places to push really hard and as Bruce said, to get angry. But there's also places to encourage our friends to do the right thing and improve the quality of the care they provide and the words they use. And that's a part and parcel to a lot of the work that we're trying to do at IAPAC.
Great, thanks. Thank you so much. Does anyone have anything else to add about the question about educating health professionals outside of HIV?
I would just say that we're really excited. IAPAC is our partner in that area. So you'll see a lot in 2008, a lot of offerings online and on-site trainings for providers, allied professionals. It's not just HIV providers. So we're excited about that. That's going to be, it's a very good question and it's important. We'll be following up with it.
Great. Thank you so much. Shanika's asking, for someone like herself who does not take medicine but is still undetectable, does U = U include those who are LTNP or elite controllers? And maybe you can explain a little bit what those terms mean, because I'm not sure if everyone knows.
Do you want to take that from the research? I have our perspective, but I think it'd be better if you want to take that, Ben. What do you think?
Yeah, so thanks for your question, Shanika. We actually have less information about, in general, about long-term non-progressors. That's the LTNP. I think from a first principles perspective, that if the virus is undetectable in your body fluid, it matters less whether you're on treatment or not. But to be factual about the science, we actually don't. We really don't know that is with the same degree of precision and accuracy. But I think to a reasonable approximation, it still applies. But I think you won't see scientific organizations coming out and endorsing that with the same vigor, simply because the science is not as robust and as detailed in long-term non-progressors. Overall, though, and I think Bruce would agree with me on this. I think U equals U still applies, and I feel very comfortable endorsing that in our clinic. And by the way, you know, in our I practice clinical medicine in Denver at the largest private practice in the 6-state region, and U equals U is a routine part of the care and education of all the people living with HIV, and in fact, not only that, but all the people receiving other HIV prevention services as well.
Great, thank you so much. Yeah, science, we can never, science, you can never say zero. There's a lot of limitations, but yeah, it seems like U equals U still applies. But there's a different question. Ebony is asking how U equals U affects breastfeeding for women living with HIV. And Shannon, I'm going to give it to you and Becca.
Yeah, that's such a great question. And, you know, similarly, we don't have the same amount of data that we do about sexual transmission. And from the data that we do have, so first of all, in the US and other developed countries, it's recommended that women living with HIV, regardless of their status, formula feed. And that's a very strong recommendation here in the US. And in other countries where there's not clean water, women are living with HIV are instructed to only breastfeed, generally for 6 months, and then abruptly wane. So it's really two different messages that are out there when you look it up online, and I think that can be confusing for folks. So what we do know is that even with an undetectable viral load, that there have been a few cases of transmission through breast milk, and we don't know enough about it to know what is the what behind it. There is a strong movement of clinicians in Europe as well as in Canada, with a very few in the US who are really having robust discussions with community about how that messaging could change and what would it look like for a woman living with HIV who's got an undetectable viral load to breastfeed, and would her infant take medications longer. And we've certainly talked women through that here at our clinic and through some of the consultation work that we've done. But it's something that we would like to see more research in and to learn more about. We also, by the way, on the HIVE website have a really lovely webinar having this discussion with clinicians, and also a woman living with HIV and her decision, as well as a blog and some stories from women who've chosen to get milk from the breast bank, or another woman who chose to have her sister be a wet nurse. And we also have some brochures for women living with HIV to help them go through that decision-making process. So we'd be super happy to talk with people specifically about their cases, you know, outside the webinar, so they feel really supported in whatever decision they make.
Thank you. So Angel is asking, my partner and I are enjoying much better sex, and I don't have to worry that he will, or I think she means that she will transmit HIV to him wearing a condom or not. Does anyone else in a serodiscordant relationship, I think there's a misspelling here. I think she's asking, does anyone skip using condoms sometimes, and how do you feel about this?
Well, I've been in a serodiscordant relationship, and yay for great sex, okay? So I've been in a serodiscordant relationship. You know, one thing that has come up was this conversation about condoms, right? I particularly wanted to use condoms, and he didn't, you know? And so it took a while for me to get over my fear that I wasn't a danger, and U equals U actually helped me with that. And so like, he just wasn't the right guy for me, but you know, like, there was some experimentation with sex that got kind of fun, you know, and I felt like a normal person, you know, just for once, you know. And so, you know, just having that communication open, and I wasn't the type to try to hide anything. So you knew where my medicine was, you knew where the daily thing was, you could see that I had taken my medicine, you know, even go to the doctor with me and hear out of the doctor's mouth that I'm still undetectable. I have a very high CD4 count, like I'm healthier than you know. So so it was things like that, you know, things that I wasn't doing normally, that pertained to my HIV status that actually allowed me to bring another person in. You know, it got to the point where I was so comfortable with it that I was even like filming my my labs being drawn, you know, and just letting people know what it is that I go through. Like, this is when I think about having HIV. You know, when I got to go get my labs drawn, and when I take that one pill, other than that, I'm free as a lock to do whatever it is I want to do. But it definitely starts with conversation and just being open and honest, and even willing to accept rejection. So.
Thank you so much for sharing that. Would anyone else care to share how U equals U has affected their sex life or not affected it?
Even though my partner and I are not intimate right now, we've taken a break from that. He's never since the beginning, and it's going on 5 years, wanted to ever use a condom. And I would make him, I said, okay, you got to put this condom on. And he refused, just like what Tiommi said. He just refused to wear a condom. But still right now, today, we're striving and we're keeping hope alive. And someday, you know, hope to give birth again.
Hello, this is Shyronn. I have been single most of my adult life, but I do occasionally date. And when we do reach that point of having romantic relationships, I proactively use condoms because I'm aware of medication resistance and how medication resistance can be transmitted through sex. And I also want to avoid pregnancies. I don't use any other form of birth control at the moment besides condoms. And, you know, other things that's possible, you know, due to not using condoms. That's just something I don't want to add to my stress. And U equals U has greatly reduced my stress of transmitting, which something I just put in the chat box, how my psychological and emotional well-being has improved from this knowledge. And my sex life hasn't changed much at all, but my emotional health, and which is very valuable to people, not just women living with HIV, just people living with HIV are dealing with a lot of stress. So knowing about U equals U just alleviated pretty much the biggest stress that I had living with the virus, is that possibility of knowing that I can likely transmit.
I want to just pop in and say I think that it's so important as we are figuring this all out to remember, particularly when we're talking about women in our sex lives, how often it is that we are disempowered in sex. And I hate to see the condom or not the condom, the U equals U or not the U equals U will become another tool in which we lose choice or control. And it's to say that there's more options for us. And it really still needs to go back to what is it that works for us, and how is it that we can support each other as women and having the sex lives that we want and the families that we want or don't want. And this just expands it. It makes it hopefully less shaming about the HIV aspect. But the reality is that we still have the patriarchy weighing down on all these other aspects of our sex lives. And I don't think we should lose sight of that when we're talking about the experiences women have, particularly when there's violence and control. And I don't want to see this used in some other way against us, you know, our bodies, when we're really looking to be liberated.
Thank you so much for that. So I have a question from Nicolette, who says she's a Ryan White medical case manager and she would like to get this campaign out to her clients. How does she get material that she can share with her clients? And there's another question also asking, it's sort of about how we can get materials or information out.
Okay, well, on our website, u=u.org, you don't spell it out and then spell it equals and then u.org, or preventionaccess.org. There's a massive amount of resources. So lots of fact sheets to download from lots of different sources from the Well Project, from UNAIDS, from NIH, lots of fact sheets and Q&As. So you can get a lot of information on our site to be able to kind of educate people about what U=U is. And then if you want to join the campaign, there's a place on the site called Community with 5 agreements that you need to agree to, and a sign-up sheet where you can sign up, and you'll see there's over 500 other organizations, 68 countries now. A group in China just signed on. So then you'll be in the loop and get a lot of information from us, although we're a bit behind with all the different things happening. But yeah, so check our website, and you could also email me and I can walk you through it.
Thank you so much. And I will send out an email to everybody who registered for the webinar that will include the recording of this and some of these links as well, so that folks can get this information and have it all in one place. So I will be sending that out either later today or tomorrow. And so we've got a question for this would probably maybe be a Dr. Ben question. Just for clarity, does a person living with HIV have to be consistently undetectable? If they go off meds, even for a short period of time, does U=U still apply?
Great question. And so U=U applies to having a suppressed virus. So the question is, in a sense, what degree of medication adherence do you need to stay suppressed? A lot of people think that it has to be 100%, and that's again another area where I think both the communication from medical providers and from community has been a bit too rigorous. So one doesn't have to be perfect to be successful. And we generally say that adherence at around the 90% level or so is sufficient to keep your virus suppressed. So in short, a missed dose here or there usually doesn't have any medical consequences and has no consequences to U=U, because again, it takes time for the virus to reemerge after one stops therapy. So a single missed dose or even 2 in the context of otherwise being medications is fine.
Great, thank you.
I just want to say to Dr. Young, thank you for saying that, because no one has ever told me that. I was very rigorous in my treatment, and in full disclosure, after the loss of my mom, I kind of, went into a depression, and I wasn't taking my medicine as I should. And I was very forthcoming with my provider, and they ran my blood, and they saw that I was still undetectable. I just thought that it was some weird fluke, but no one had ever explained to me that at least, a 90% treatment regimen will continue that undetectable status. And so just thank you for that.
Well, you're very welcome. Again, I think you have to realize that HIV medications today, modern meds, work really well. They don't require a stopwatch. They don't require, that degree of precision. They simply work. And when we start doing that, then we stop stigmatizing and prioritizing life around our wristwatches or the clock on the wall. And HIV doesn't impact that. But a lot of the work that I do online, I get questions every week from concerned members of the community, people living with HIV who say, I missed my dose by 15 minutes. Am I going to die? Am I going to transmit this virus to others? And I think we have to really make sure we, as part and parcel of this communication, that we tell people that, it's okay. Medications work. You don't have to be perfect. You are, nobody is. And medications. Okay.
Thank you. Bruce, I see, are you jumping in there or? No, okay.
No, I was just going.
Oh, okay. It switched to you for a second, so I thought maybe you were about to say something. Okay, let's see here. So Naima has a question. This is an interesting one. How does U equals U impact HIV criminalization, or does it? She says that in Ohio, they're working on changing the HIV laws. There are definitely some differing opinions around this, so I would be, and I don't think there's one right answer per se, but I would definitely be interested in hearing what folks think about the issue of HIV criminalization and how U equals U affects that or does not affect that.
Yeah, I'd love to answer that one. I mean, it's a really complex issue, and when we do our training seminars, and actually on our website, you can see that we've endorsed a consensus statement with the Center for HIV Law and Policy to make sure that advocates are aware, because there's always new advocates coming into the field. People may not be aware of this, that it could cause a real problem if U equals U is written into the laws, because it could then subject people who have detectable viral loads to these laws that are heinous and bad for everyone, bad, unjust laws, bad for public health. And so you'd have these two classes of people who are undetectable, who are not, dangerous, and then people who are detectable that are dangerous. And those people who are detectable are often people who are already left out by the healthcare system and marginalized. So that's something we just need to be really, really aware of. And people have all sorts of opinions on it, but we are not crim experts, but we put that message out there just to be mindful of it, to make sure folks are mindful of it.
Yeah, we incorporated the recent data on transmission into the international consensus statement around HIV transmission and the criminal law, and that hopefully will be released after the first of the year. I will say, Bruce, to your credit, though, in individual court cases, the availability of data around undetectability has been instrumental in acquitting people. So it's actually again, it's important to have that message around what U equals U is and what it's not. It's also important to recognize the power of being able to say in a court, when someone has been charged with a crime, that the presence of that data about being undetectable actually has, and I have testified in a military case, a serviceman acquitted with the knowledge that he was undetectable, and with the knowledge that he had multiple, he was durably virologically suppressed, was adherent to his medications and such. And so it is a very powerful piece of information. Hopefully we never have to use it in the first place, but in the event that we do, it is still relevant in the criminal courts.
That's a really good point. I should have mentioned that. On the individual level, it's very important. We're actually seeing it being used in the United States too. Kerry Foote, and I had given some information to someone down in the South, and the CDC's letter actually helped him get acquitted. I'm not sure what the legal term was, but it helped as a defense, and we're seeing it all over the world. A group in Czechoslovakia contacted us for the consensus statement to use that. So yeah, I think that's really important. I'm glad you clarified that, Ben.
And one quick thing important to note too is that the laws were wrong even without U equals U, and that in changing them, we also need to take the burden off of people living with HIV, and in our advocacy talk about PrEP and condoms and other things, because that's one of the things that's effed up about the laws, is it puts all of the burden on people living with HIV in a way that is not acceptable. So I think it's helpful in educating folks, but I don't think it can be the linchpin turning point in the why.
Thank you for that. Yeah, we at PWN, we definitely agree. That it's an important piece of information that legislators should know about. In considering why the laws are bad, but it's not. We definitely don't want to be creating two classes of people, because there are people who don't have access to healthcare, or in some cases they might have a resistant virus that they can't be virally suppressed. So we definitely want to avoid turning one group into the bad guy while the other group is the good guy. But definitely on an individual case by case thing, it's a very good defense, because you can, obviously you did not intend, you were not trying to transmit HIV if you were taking your medications, and that actually prevents transmission. So thank you all for addressing that. And sort of along the same lines, I want to throw a question out there around access. What do you think? Because I think some of the criticism the U=U campaign has gotten has been sort of around, well, what about the people who don't have access to these medications, so they can't, achieve U=U? What is this campaign stigmatizing to them? Is it demonizing them? So how, and I want this question to go out to sort of all the panelists, because I know everyone probably has different thoughts about it. How do we address access when we're talking about U=U? What is the connection, and how can we bring that into the conversation or use U=U in our advocacy for access to healthcare?
Okay, well, speaking from a trans perspective, we actually have to have access to an environment that is LGBT friendly. We need to know that, we're not going to be ridiculed from the moment that we walk through the door, sit there in an uncomfortable waiting room under stairs, because we're never going to get to undetectable that way, right? So, if there isn't some type of sensitivity training that is done inside of these providers' offices, then that's a demographic that they're always going to miss. So then what do we do? Do we do mobile units? Do we go to them? I would love to say that we go to them, but how many people are actually willing to go where it is that trans women feel the most comfortable, right? Because it's not actually a professional setting. It's not probably going to be a sterile setting. So we need to work on how to actually make them feel comfortable in the doctor's room, in the doctor's office, and other places like that. Case managers, my experience, my case manager wanted to sit up and talk about my body parts versus what's going on inside of my body. I'm not here to try to make you feel comfortable about who is sitting across from you. I'm here to help myself. You're supposed to be the conduit to getting me to get to the doctor's office. But I got to sit here and answer all these probing questions, which have absolutely nothing to do with this intake form, right? So had it been someone else, they probably never would have gotten into treatment because there was no sensitivity training. What goes on underneath my clothes are none of your business. We're talking about what's going on inside of my body. But that's from a trans perspective, so that's one.
Thank you so much for that. What do other folks think? How do we address the issue of access and U=U?
I mean, I have something to say, but I was going to let other folks go first. So if no one else, does anyone want to jump in?
Well, I actually have to jump in for a different reason. I'm going to just hijack a little bit. I have to jump off the call. So I just wanted to say thank you all for the invitation to participate. And again, I'm honored and inspired by all of you. So thanks again.
Thank you so much.
Bye,
we'll talk soon.
Okay, well, so I could talk a little bit on the issue of access. Yeah, it's a critical issue. We have a section where we sort of have tried to spell this out on our website called the third U. Marcia Martin came up with that. We love it. The third U, unequal access to treatment, care, and testing. But what sometimes has been lost over the conversations, or actually I should say attacks on the campaign over the last year, that some people don't have access, your campaign is stigmatizing people, and what about people who don't have viral load testing? Well, the truth is, and if you step back and think about it really carefully, not throwing grenades at us, but if you step back, as you can tell, I've had a lot of grenades thrown, if you step back and say, what is our argument for access? Well, what we've had in the past for argument for access was we have a right to health care. We want access to save our lives, basically. We demand access to save our lives. Now, what I've learned in my short time in the field, and sadly and very blatantly, people have said, that's not our job to save your lives. Our job is to prevent HIV. Our job is to protect HIV negative people. So our emotional and sexual and reproductive lives and health don't really matter. to policymakers. I was shocked, but people were blatantly said that. That's not the approach to us. Healthcare, a right to healthcare. What right? They said. What is this going to do for prevention? So now what we have is we need access to save our lives. And if you get us access to treatment so that we can go on treatment and we have the care and the services to stay undetectable, we'll stop new transmissions and get closer to the ending the epidemic. So you've got these dual benefits now, and it's the best argument we've ever had for people to get access. So that's why we're working with a group like ITPC Global, which is the specialist in getting access to treatment and viral load testing in the Global South. So they're a partner. They're developing, integrating U equals U into their trainings. We just did a training with them in South Africa. It's fantastic. It's awesome, you know. And we really need, and all of you here online and watching, please, when you hear people say, well, we don't want to support U equals U because they're stigmatizing people who don't have access to treatment, please walk them through the whole advocacy argument. It's a public health argument to get people access. It's the best argument we've had, okay? Kathy Hires is using it in her advocacy from AIDS Alabama. You know, please, we've seen it even working in places in sub-Saharan Africa, and people and policymakers are saying they're going to change policy because they want to end the epidemic. And they know this is a critical piece. So sorry that was long-winded, but it's really important. And we need advocates to use it. Use it in your advocacy, please. Don't throw the baby out with the bathwater. Think deeper about it. Think much deeper.
Great, thank you so much. And I think it's also important just to note that even without access, it's still information that people have a right to know. And it can also help motivate advocacy, because if you know that you have this tool and the thing that's stopping you is you know, the lack of access because we have a bad healthcare system that leaves people out, you know, that's just another motivator to fight for it. But it's information that everybody is entitled to, regardless of how much money you have or your insurance plan, if you have one, et cetera. So thank you.
Benny, thank you for saying that. Yeah, and I should mention that if you look on our site, we have partners in Kiev and in Estonia and Latvia and Moscow and St. Petersburg, and they have much more severe problems than we could ever imagine accessing treatment, and they are using this. They're rising up to demand access to treatment. They're becoming more, we're seeing new activism because of U equals U. So it's really important not to just throw the campaign away because people don't have access. Please don't think bigger on that. And we also all deserve information. It's information, as Jenny said.
Thanks. Do any other panelists have anything to add around access and U equals U? No? Okay. Oh, Stacy, did you have something?
I just want to say something briefly. You know, having access, you know, anybody that wants to have access to U equals U has a choice. It's a choice. And see, life is about choices. So if you believe in it, you first have to believe in it in order to have access to it. And once you believe in it, then the access is unsurmountable. I mean, you can go to the limit, sky's the limits with it. And you can take it very far.
Thank you. I saw that Tammy had her hand raised, and unfortunately, I'm not sure how long it was raised for, but Tammy, I did promote you to presenter if you had something you wanted to, a question, or if you had something you wanted to add. I just unmuted you if you still wanted to say something. Are you there? Okay, I'm not hearing her. Tammy, let me know if you want to come back and say something or ask a question. Does someone say something? Or am I just hearing stuff? I'm just hearing things. Okay, I have a question here that says, I'm a long-term non-progressor and I've stopped dating because I have a consistent viral load, kind of a straight line. I have psychological damage. How do I get over this? Well, I don't know if any of the panelists are long-term non-progressors, but I think that they can probably address what it feels like to, you know, have a fear of dating or of intimate relationships because of their HIV status. I don't know if anyone would like to share.
Well, I spoke about that earlier. This is Tiommi. Not sure if you're on the phone or on the computer, but I spoke about that earlier and how I took myself off the market because I lived with that same fear. And that was even after, you know, getting that undetectable reading for the first time. And, you know, but still I was told that there was a 4% chance that I could transmit the virus to someone. And at that point, I wasn't really fond of condoms. So I took myself off the market, like I said. It actually took me getting in to talk to a professional to realize that, you know, I'm not a danger. I am not a danger. And I don't have to always listen to what it is that this doctor is saying to me because I know my body, right? I've walked around with this body for 40 years. I think I've gotten to know every ache, pain, you know, groan, and know exactly what it's associated with. And so what I couldn't allow the doctor to do was to override my psyche into thinking that I was a danger to someone else. I needed that confirmation with U equals U. I stopped taking medicine for a while. I saw that, you know, I was undetectable when I went back to have my labs drawn. You know, I just went through a whole bunch of stuff last year that kind of threw me off of my treatment regimen. You know, but at the same time, like I'm fighting to get it back. I don't have a detectable viral load now. That's not what I'm saying. You know, it just took more than myself to get me back to where I was, like mentally. So to me, that is definitely like, you know, a mental health thing that you're doing to yourself. Like you're believing the hype. And so once you've bought into something, it's kind of hard to, you know, get out of that without help in seeing how you were wrong to get there, how you've been unfair to yourself. Not to say that you're wrong, but just that, you know, you've been unfair to yourself, because I can say that I was unfair to myself as well. Not that I was wrong, but just that I was unfair.
Thanks, Tiommi. Would anyone else like to address the question around how one can kind of overcome psychological damage and to be able to enjoy a healthy relationship again?
I wonder what it's like to be able to talk about that with other people who care and who understand. I feel for myself when I get myself isolated or I feel cut off, I start making decisions that, you know, are like in a dark tunnel. And it's somehow trying to get into a place where there's more light. And I think oftentimes that can be talking with other folks, going through the scenarios, practicing disclosing to someone, getting comfortable with it so that we aren't feeling so alone.
Thank you. And since you mentioned disclosure, we have a question here that I think is an important one. With having this information, I'm assuming U equals U, does that remove the responsibility of disclosure?
It's really such a good question. And it really depends on two things. One, local law, and two, local practice. Because the law can be one thing and then the clinic's practice or the community's practice can be something else. So I think it's super important to ask a trusted advocate and community member wherever you are. And if you move, to find out in the new place, what is the what of what's happening, and informing yourself. And then again, getting support from folks about how you can walk that line that feels most truthful for you and feels the safest.
Thank you. Yeah, I think it's really important to know that since we do still have HIV criminalization laws, and I think about 36 states or at least 32 states, and they obviously are not, these laws haven't caught up with science. You know, it is important to understand that, you know, even though we know this information, doctors know this information, scientists know this information, it doesn't necessarily stop you from getting charged. So knowing what, like Shannon said, knowing what the laws are, and they're different from place to place. So knowing what the laws are where you live is definitely really important in terms of disclosure. And then let's see here, got a few more questions here. Still along the lines of these laws and disclosure, I've been undetectable for years, yet I still fear criminalization laws. Can a person from 10 years ago charge us with a crime if we knew we were positive and did not disclose? And will U equals U affect this?
The way that it's set up now, anyone can say that, you know, the burden of proof still falls on us. Actually, you know, Jenny spoke to it earlier that the law hasn't caught up to the science. And so the science is not quite actually in the courtroom, if you were to make it into the courtroom like that. But, you know, who's to say, I mean, like if it was me 10 years ago, really? 10 years ago, you know, did you just stop having sex? You know, and what, you found out 10 years ago? Like, don't come at me 10 years later after 10 years of experiencing life and say that you pinpointed it, that it was me. You know, I used to worry about that a lot. And so that's why I took myself off the market, because although I disclosed my status to my sexual partners, you know, like I'm still single. So any one of them could have come at me and said that I didn't share my status with them, and the burden of proof would have fallen on me. And sometimes, you know, like even disclosing the fact that you're positive is not sufficient in the courtroom. It's just the fact that you actually engaged in sex as a person living with HIV. So my suggestion is to actually know the laws in your area, right? Because those are the ones that are most pertinent to you.
Thank you, Tiommi. Does anyone have anything to add to the question on disclosure or potentially being criminalized for something a long time ago? I think it is important, if it were ever to happen, you know, and you know that you've been undetectable for X amount of time, like we were saying earlier with Dr. Young and Bruce, you can always use it as a defense as well, because it certainly shows that there was no intent involved. So, and also that it was an impossibility for transmission. Would anyone like to add anything to that question before we move on?
I just want to add the piece about, again, talking with folks and getting support, because I think living with that fear, it's so much. It's such a burden to carry. And we have fears about relationships and people and, you know, things from the past. And then like how much of it is based in reality? So figuring out the law, but then who can hold your hand in that and talk through like, what would it be like? Or how can you make this go away? Is it disclosing now? Is that helpful or not? Or, you know, just to brainstorm, because then how do we live with less burden on ourselves and more freedom? I think it needs to be one of our goals.
Definitely, thank you. And Shannon, putting this one back to you, just to be clear, this is about breastfeeding again. So just to be clear, not breastfeeding in the US is a recommendation. So I guess feeding with formula is a recommendation in the US. If a woman living with HIV chose to breastfeed because she's undetectable and the baby would go on treatment, she could make that choice and it would not be considered a child neglect issue. Is that accurate?
I would not say that's accurate. I think that depends on where you live, and the women who have chosen to breastfeed have done so with involvement from their provider and signing paperwork. And there's some places where it would concern me that people would think about it as a child neglect issue. You know, similarly for a woman who's pregnant and doesn't take medication for whatever reason, you know, that can come up. So I feel in
that situation, best to get a trusted provider helping you and to really understand what the lay of the land is with your provider, the local child protection agency, and the hospital where you will deliver, because there's a number of people involved who could make that decision so that you feel really supported. And we're super happy to talk through that with folks to make sure they feel supported.
Thank you. I saw Tammy had her hand raised again. So Tammy, I just promoted you to presenter if you would like to speak. I see you. I don't hear you yet.
Unfortunately, I'm on the phone and I think, oh, there we go. I think I have it figured out. Can you hear me? Can you hear me?
We hear you.
Oh, wonderful. Thank you. I have not had internet for 2 days, so I'm using my phone for the first time for one of these calls. I just wanted to say from experience from Iowa about the question about when you can be charged, because I wanted to get I didn't know how things worked, and I am not a legal professional, obviously, but from my experience, I wanted to get the law changed before one Iowan was going to have to go to court, and then I found out that it doesn't matter when we got the law changed. You are charged under what the law is when the supposed crime or action took place. So it wouldn't have mattered if we got the law modernized now. We would hope that the judge would take into account the new law, but unfortunately Donald was convicted before we got our law modernized in Iowa in 2014. But you are charged on what the law is at the time the supposed crime happened. So even if that is 10 years ago, we would hope that no prosecutor would take a case that is over 10 years old. However, depending on the prosecutor, they could. And so I know that impacted many Iowans who, with disclosure, because, if the person that they had been with 3 years ago or 10 years ago found out their status, they could be charged under the law. So you have to be very careful, and that's one of the problems with these laws, is one, they are so outdated, but that is also one thing that is a factor in disclosure, is worrying that somebody you had sex with previous to a law being modernized, you could, if the prosecutor was aggressive, you could be charged under what that law is at the time. That is my experience in Iowa as we were trying to modernize our law.
Thank you. Thank you for sharing that. Yeah, hopefully, hopefully we're going to get rid of all of these laws, and if anyone were really trying to bring up something so old, hopefully a prosecutor would have good discretion, but it's still definitely a fight that we're working on many fronts. So we have a question here. As an educator case manager, do I still discuss PrEP therapy, especially with serodiscordant couples?
I could grab that, or Shannon, but I just want to I have to jump off really in a second. I just, can I quickly just say that to people who are listening in, and everyone on the panel, if you're, doing this work and kind of, you'll find yourself in positions where you feel like you need to prove to people that you're a danger. It's exhausting. It's maddening, because you're proving to people that you and the people you know and the people that you love about who are also HIV positive are not a danger. And if you can join our Facebook group, and you'll feel less alone in that fight. And for me, what helps is to try to move from fighting to educating people, and borrowing confidence from the experts that I'm not a danger. None of us with HIV at any level of viral load are a danger. And if the folks that are fighting us, especially when they're in their own community, will come around. eventually. They will come around, and so we need each other. We have to stick together. So please join our group, and you're not a danger. No one is a danger. And then on the prep question, real quick, is that no? What we say is that prep isn't medically necessary when the HIV positive partner has a sustained undetectable viral load, but that doesn't mean that the HIV negative partner that prep wouldn't be helpful, because there could be situations where the HIV negative partner is having sex outside the relationship. PrEP undetectable only protects a partner from the person who's undetectable. It's not going to protect from a third party. Also, maybe just a sense of agency. There's no shame in taking PrEP. If you want to feel like you'll feel a little bit safer or more responsible, or that's fine. It's not medically necessary, but it can be empowering for people. And then finally, the partners may be struggling with adherence issues. So, if your partner is having challenges being adherent, then that means they may not be consistently undetectable, and that's might be a reason to go on PrEP. But Shannon can also take that on, and I've got to jump. Thank you so much for having me on this call. This is like one of my favorite webinars ever, because I love these women and Ben, and all of you have made this campaign a success. I mean, all of you have played such a huge role. So from the very beginning. So. Love you all. Bye-bye. Thank you.
Thank you, Bruce. Good flight.
Thank you.
Great.
So I would say about the PrEP piece is that no provider knows what's right for a couple. And really not enough people know about U = U, and not enough people know about PrEP. And it's really up to a couple and an individual to decide what's best for them. And what best for a couple at one point might be a different choice later in the relationship or with a different relationship. And it's really about putting this information and choice in the hands of the people and telling them the truth, and then letting them decide what works best for them. There's lots of reasons why PrEP might be great. Maybe I don't want to get into it with my partner about their viral loads. Maybe that's not part of the relationship, me being involved in their care. Maybe I, am openly or not having sex with someone else. Maybe I have a lot of fear and PrEP makes me feel better. So there's just so many reasons why it can be a good choice. There's so many reasons why people would choose not to use PrEP too, but it's theirs.
It's a tool in the toolbox. Thank you. Shyronn, were you going to say something?
Yes, I was going to say that the more information, the better. And especially for those who have the information, to not spend so much time deciding on what to share and who to share it with. Just openly share the information and allow people to analyze the information and use it as appropriate for them, whether they're going to use it for themselves or if they're going to share the knowledge with someone else. So my vote is on case managers, especially medical case managers, to provide as much information about PrEP, treatment as prevention, and also post-exposure prophylactics.
Excellent. Thank you so much. So we're almost out of time. I'm going to close with one last question. So why are so many, and this is open to speculation because there might be very many different reasons, but just to get a final take, why are so many HIV providers reluctant to share this information? It seems like at best providers will say U = U, but, and then use language like mostly, probably, for the most part, 96%. Any thoughts on why doctors are not telling what we know to be the truth about U = U?
I would like to start by saying that I believe a lot of providers truly don't trust the intelligence of people living with HIV. Unfortunately, that is the case. And at times, which is the case too, that some people who live with HIV may tend to play like they don't know better. Unfortunately, it does happen where people tend to like dumb themselves down to come across as if they don't know better. But you know, the truth of the matter is people know more than what we think they know. And going back to the first half of that, a lot of providers believe that people living with HIV are not going to behave in a sensible manner, where the fact is, like myself, like I said, because I know the other risk that's out there with having unprotected sex, you know, I'm able to take this information and use it responsibly. But for the most part, I just think it's providers just undermining the people that they serve, and we are able to take care of ourselves.
So much. What do other folks think?
My take on it is they don't want to lose their jobs because they know that eventually U equals U is leading to a cure. And, you know, if it wasn't for persons living with HIV, then, you know, they wouldn't have a job. And they fear that. They fear of losing money. They fear losing money. Point blank.
Great, thank you so much. Well, we are right at time, so let's go ahead and close it out. I want to thank all of our panelists once again so much for your time and for sharing your information and your knowledge and your experiences with everyone. And also thank you especially to Stacy and Shyronn and Tiommi for sharing your stories in the video, which will live on our website. I will be sending a follow-up email to everyone who's registered with some of this, with links to more information, a link to the recording, etc. So if you didn't, you know, if you want to get in touch with Shannon or Bruce or, you know, see the U equals U campaign website, all that, I will be sending out links. So thank you everyone for your time and participation, and look forward to talking to everyone soon. I hope everyone has a great rest of your day and a good World AIDS Day. You know, get the message out, share the knowledge. Bye, everyone.
Bye-bye.
Thank you.
Bye.